The Medical Concierge Service, or MCS for short, is designed to give our members information about the quality and cost of their health care that they may receive. This information isn't readily available to members, and what we do is we put it into an easy-to-use format so our members can better understand and make better use of that information when they're making their healthcare decisions.
We developed the concierge service because we recognized that there was a real paucity, a lack of data for people whenever they're going to choose a provider.
Well, you may not know this, but pricing from one hospital to another can vary dramatically for the exact same procedure. Oftentimes you can see anywhere from 100 to 200% price differential for the exact same procedure, oftentimes for facilities that are right up the street from one another.
And then when you add in other geographies, you can have even further variation among those. And again, we're talking about the price to the patient or to their health plan.
What the MCS does is when you have been told by your provider that you need to have a procedure or a test somewhere down the line, a week or two down the line, you can call the MCS and give the information about what testing or procedure needs to be done, and then the MCS can gather information about cost and quality in your area for different facilities, and then give that information back to you so that you can make an informed decision on where you'd like to go get your care.
We often get the question, do facilities that charge the most render the highest quality care? What we found is very little to no correlation between the two.
Just because a facility charges more does not necessarily mean their quality is higher.
And that's why we look at both cost and quality when we're giving the data to somebody to help make the decision.
The Medical Concierge Service will not interfere with the patient's health care. It's really meant to educate the consumer so they can make better decisions and supplement that relationship that they have with their healthcare provider.
A typical situation to contact the medical concierge would be, for example, you're going to have an inpatient surgery, something that can be scheduled ahead. It's not something that has to be done tomorrow, so there's a little bit of time to review information and make a decision. An example of that might be a hip replacement. So a patient would give us a call, tell us they're going to have a hip replacement. We would ask for their physician name, who is recommending the replacement. We would ask what geographic area they're in and what geographic area they're willing to look at. And then we will first contact their doctor and find out what is the exact replacement, what is the exact procedure they're going to do for the replacement, because there is a little bit of variation there. And then we'll go into our data, research that, come back with information about providers, cost and quality, present it to the patient, talk through it with them, and then find out which of these providers are they most interested in. And then we'll contact those providers and further negotiate a rate on their behalf.
The substantial savings that can come from these decisions obviously have a big effect on the bottom line for a company's health plan and even the individual's out-of-pocket expenses.
When you contact a medical concierge service representative, the information you'll need to provide is your name, your employer's name, the general geographic area that you're looking to seek service, and sort of a general overview of the type of medical procedure you're seeking.
The report that we produce can be sent to the patient in any way they would prefer. We can send it through email, through U.S. mail, by fax. We'll find that out when we make the first call and we talk with him.
Now, many will wonder, where does this information come from and what will be included in this medical concierge report? I think there's a couple things that's important to remember. One, the report's not going to be filled with a lot of medical technical terms and medical jargon. But two, it also provides information in a format that allows for a true apples-to-apples comparison.
The data that the MCS uses to compare one facility to another is truly an apples-to-apples comparison because we take diagnostic and therapeutic codes that are used by facilities in their billing process and compare specifically one code to the same code in a different facility. So a similar procedure that might be more complicated because of a patient's concurrent illnesses, that's going to have a different code than the procedure that's occurring in somebody that doesn't have any problems. So we're able to take those specific codes because what we don't want to do is select out cost and quality data from a facility that's only doing the easy cases compared to the one that's the referral center getting all of the difficult cases. And so by taking those codes, we can compare apples to apples.
After the patient has had a couple of days to review the report that we've sent that includes quality and cost data, then we'll give the patient a call and talk through it, see if they have any questions, and then we'll be asking for them to select what provider they're interested in, or maybe the top 2 or 3 providers they're interested in. And then what we'll do next is we'll contact the provider. We can actually schedule the procedure for the patient if they would like, or they may prefer to schedule on their own, but we can also negotiate even a better rate at that point.
The objective of the medical concierge is to educate the consumer so they can make better decisions when they're out in the marketplace.
The MCS will never interfere with a patient's care. It's not designed for that. It's not designed to tell you where you're supposed to go to get a test done or a procedure done. That's always your decision. It will always be entirely your decision.
The one thing I'd like people to think about is whenever you make a major purchase of your own, whether it's a house or a car, you always gather information and you make the best choice that you can. And all we're saying is your health care deserves the same consideration.